Hi everybody, I know we have 5 minutes left, so I'm going to run through this presentation quite quickly, but the Capstone project is something that is required for you to complete your global citizen and your global scholar to earn the certificate that we are offering through the Global Health Program. Okay, so I'm going to talk a little bit about that and what it entails. Dr. Kaufman is actually going to be walking around. If you are a first-year student in the GLUE program, a new student, I'm going to ask you to please put your name, your email address, and rank your interests on the sheet. It does not mean that you are committing to this particular project at this point in time. It's just so that we can get an idea so we can get you into groups, okay? So please make sure that you hand that to me before the end of the night or leave it on the table so that I have that from you. So a lot of people have a lot of questions about the Capstone Expectations and what a Capstone project is. So basically what we're trying to do is we're trying to help you integrate all of the important things that you're learning in this course into some real world projects, okay? So we want you to be able to work with a local or a global organization and be able to incorporate all the skills that you've learned during the course of the year. We have some global sites that we're offering, and we have local sites. And again, this is all your personal preference. And again, I encourage you to maybe do something that's a little bit out of your comfort zone. If there's a topic that you're like, maybe, I've never worked with that before. Maybe this is a good opportunity for you to learn something that you never really anticipated you would learn about before. So we do have 4 global sites that are going to be offered, including Laos, India, Haiti, and the Dominican Republic. So again, just real quickly, if you have questions about Laos, you think that's something that you're interested in, I do want to point out anybody who's interested in doing one of the global trips, you are financially responsible for the trip, and we do have specific times of the year that these trips are offered. Okay, so if that's a limitation for you in terms of school or family or work or other responsibilities, just keep that in mind. Okay. So Dr. Kaufman takes the group to Laos, and unfortunately this is not open to all GLUE scholars. Right now at this time it's open to residents in emergency medicine, internal medicine, and pediatrics, and we're hoping in the future that we can offer it to other GLUE scholars. In terms of India, Dr. Kumar can answer your questions about India. We have a connection there with a girls' school that has about 600 students. They're doing a lot of education, and there's some ongoing projects there. I just want to point out with the global projects, you'd be incorporating some of the projects that are already ongoing in these countries. So these are a little bit different in terms of issue-specific and more site-specific projects. Again, this is open to all GLUE scholars, and keep in mind, this trip is going to be in August of 2019. Haiti is a new connection that we were able to establish last year, and Dr. Lisa Allensbach and Dr. Jeff Van Leer actually led a group of Wayne State students from the medical school that went last year, and we created what we think is going to be an amazing partnership. The students and physicians that participated had a great time. This is actually going to be through the World Health Student Organization at Wayne State, and they're planning to go for 1 week between March and April. So again, keep this in mind. And then Dominican Republic is another option. We haven't worked out all of the details for this trip yet, but this is another trip that is through the Wayne State University School of Medicine World Health Student Organization group, and they'll be going about the same time for 1 week. So those are the international sites. And then in terms of the local sites, and I put local sites / projects, just because again, these are a little bit more project specific and issue specific. We're working really hard to establish some strong relationships with organizations in the community to work on different projects. So we have some projects that are in the works right now with some of our second year GLUE students. And our intention and hope for the local and the global projects is that maybe some of these projects can be long-term. So maybe you can see what that first capstone group is doing and say, hey, that's really cool. Maybe we can build off of that. So that's some of the intention for these projects and ongoing. So we have First Aid First, we have some work going on at the Amaritas Center, D-Live, and Immigrant Issues. So First Aid First is led by Dr. Kaufman again from the Department of Emergency Medicine, and they're providing first aid education to the lay community in the city of Detroit. I do a lot of work with medical students at the Amaritas Center, which is actually a homeless shelter for families. So currently the Capstone group is working more on nutrition and some urban farming ideas and things like that, but there are a plethora of ideas and issues that could be addressed in this particular setting, and we have a really strong relationship with the Amaritas Center. So again, we do a clinic there, so homeless healthcare, health education, health prevention. So the opportunities here are endless just because of the diversity of issues that they deal with in their center. D-Live is a new project. This is Detroit Life is Valuable. So this is a community-based, or hospital-based community-focused violence intervention initiative. Again, this is a newer relationship that we've established, so we're excited about this. So if injury prevention or something like that is your interest, then this might be a good opportunity. And finally, immigrant issues. So again, site is blank because we're still working on establishing some strong relationships with organizations in the community. So at this point, it looks like we're moving forward with Freedom House, but there's also some opportunities, as there's a Hamtramck Health Clinic, and Dr. Kumar, Dr. Snell, and Dr. Nodim are all helping to work with this particular issue. So again, that's just kind of an overview of the connections and the established relationships we have at this point in time. So like I said before, this is formal. It's not necessarily a research project. But again, what it is we want you to use the skills and the tools that you're getting in the classes that we're doing to be able to go out into the community and apply these principles, and then come back and have something sustainable, some sort of paper, some sort of poster to present to the group and share with the class, okay? And we want these projects, this is something that we're not expecting you to work independently on. We're encouraging group work. So again, this is not all on you, but we are going to be expecting a timeline and having you complete different parts of the project in a timely fashion as we go throughout the year. Any questions right now? Yes. So yes, if you have specific questions regarding some of those dates, please talk to those of us who are involved, okay? Especially with the international travel. I know that makes it a little bit, it changes your timeline a little bit. Any other questions at this moment? Yes. Mm-hmm. Yes. Yes, you would be expected, if you're going to be participating in one of their trips, you would be expected to follow through with the commitments that are expected for their trips. Fortunately, we're incorporating a lot of the glue classes and things like that into it, so it's not, we wouldn't make you be doing a lot of other things, but that would be one of the expectations, okay? If you have some established relationship with another clinic, I would encourage you to please come talk to me, because again, we're trying to build relationships. The reason that we are keeping it a little bit tighter right now is because this is new. All of us as leaders of this organization, Christiana and EGOMA have done an amazing job setting up this curriculum, but we're also learning as we go. And part of the Capstone project, we're learning as we go as well. So if we have 50 people working on 50 different projects, it makes it a little bit challenging for us right now to provide the mentorship. But if you have some established organizations in the community and you think that we could establish partnerships, please come and talk to me. And yes, we would be more than happy to try to entertain that idea and see if we can work something out. Yeah.
So we're hoping to structure this so that the last half hour of every class is going to be put aside for Capstone time. That was our intent today. You guys are doing such a dynamic job in the meeting, we just let it go. Okay, so if you want to meet the groups that already established second year, if you want to take this next little bit of time and meet, that's great. What we're going to plan is for next month. We're going to stop at 8 on the dot, and you are going to hopefully by then review this. If you have any questions, email the directors directly, and then you will assign yourself to the group, and then we'll have you guys meet the first time.
So the intention of the paper that I'm going to collect from you is just to kind of get an idea from the group, and we'll kind of see where people's interests lie, and so we can get you divided. And again, if you go home and think about it tonight and you say, hey, I don't think that's the right group for me, or I would like to change my mind, that's okay. But we are going to we're going to push you a little bit more than the group last year to make a commitment early so that we can get you working with the groups that are second years to see what their projects already are and how you might be able to kind of tailor your projects to some that are already ongoing. Okay? Thank you guys for your attention today, and we'll collect your sheets.
So bring your sheets right here, and if you haven't yet, put the stickers before up so you can put it on the stuff.